So we are presenting on child abuse. My name is Elizabeth.
I'm Emily. I'm Sarah.
Great, so April is Child Abuse Awareness Month, which fits perfectly into this presentation. And we're all wearing blue, which is the color for child abuse awareness. Great, so child abuse is any non-accidental act on a child under the age of 18, putting them at risk for neglect, physical, sexual, or emotional abuse. Typically, those who inflict child abuse tend to be known by the child as either parent, caretaker, or guardian. And the different types of child abuse are neglect, which is the child is not receiving the basic necessities for survival like food, shelter, clothing, or medical care. Physical abuse is an act of physical injury resulting in hematomas, fractures, or broken bones, hair loss, bleeding, and much more. And sexual abuse victimizes the child through unwanted sexual exploitation like rape, pornography, and sex trafficking. And emotional abuse is impaired competence or emotional stability as seen by the changes in behavior and or cognitive regression in children.
The signs and symptoms can be difficult to distinguish between, but generally speaking, the child can display poor concentration skills, they may have an eating disorder, or show fear, anxiety, or depression when around a specific individual, or they may reach their milestones later than the average child would. Some symptoms that may be included are difficulty with physical maneuvers that may possibly be due to muscle strains from somebody grabbing them or pushing them, as well as sprains from an unusual twist. Diagnosing and treating is very tricky, so it's good to obtain parental consent first. Most of the diagnosing techniques are things that we usually hear about in doctors' offices. Typically, they will do x-rays, toxicology screenings, drug testing, and lab testing, as well as do physical and mental evaluations to make sure that the diagnosis is legitimate to child abuse. However, it's important to cooperate with the authorities and child protective services in order to get to the bottom of the case. Medical history and family history should be considered before treating in case of any allergies. You don't want to speed up a child's reaction to anything. Treatment methods include therapy such as OT, PT, speech therapy, cognitive or behavioral therapy, as well as physically treating injuries like setting broken bones or bandaging lacerations.
So child abuse causes many short and long-term health issues. Physical health issues can range from mild to severe and has been linked to causing many chronic illnesses later in life. Child abuse can also have serious long-term psychological effects, and those who experience child abuse are at a much greater risk for mental illness, such as depression and social and cognitive issues. Many behavioral and social issues are seen in children who are abused as well and have been linked to child delinquency. Children are 9 times more likely to participate in criminal activity and are more likely to use and abuse drugs later in life.
So to kind of put child abuse into an easier perspective for us to comprehend, mortality rates of males tend to be highest in all abuse cases worldwide. And it's kind of interesting, a child is reported abused every 10 seconds, so in the time that you are watching this, at least 60 cases will be reported. Physical abuse is the most common, followed by neglect, sexual abuse, and emotional abuse. And those who are at risk, especially for sexual abuse, 1 in 3 females will be at risk for sexual abuse, and 1 in 5 males are at risk. However, risk doesn't necessarily discriminate on age, gender, nationality, race, ethnicity, except for sexual abuse. And then, as you can see, there are some factors that contribute to the child's risk factors. They have protective factors as well, such as good health, good social skills, high self-esteem, rules that are set in the home, a religious background, and a positive school setting. The abusers tend to be between 19 and 25 years of age. Typically, mothers tend to do the abusing, but fathers are more likely to do the sexual abuse. Some other factors that contribute to abusers abusing are unemployment, substance abuse, poor education, and singleness. And this is our Healthy People 2020 objective, IVP 38, is to reduce non-fatal child maltreatment based on the data that 9.4 victims of childhood maltreatment per 1,000 are under 18 years of age.
So the Child Abuse Prevention and Treatment Act is to provide federal funds to states for the prevention, identification, and treatment of child abuse and neglect. In Virginia, child abuse is a Class 4 felony, which can result in 2 to 10 years in prison and a $100,000 fine. This does vary state by state, though, and the Child Welfare Information Gateway requires reporting of all child abuse incidences.
An agency that helps to prevent child abuse is the Prevention Research Center for Family and Child Health at the University of Colorado in Denver. There's 3 major research focuses for the Prevention Research Center, and they are the Home Visitation Program, the Program Improvement, and International Program Implementation. The Home Visitation Program is now known as the Nurse Family Partnership, and it focuses on first-time low-income mothers to help improve the mother transition into a more responsible adult role. Program Improvement also reviews the published research on improving the NFP and making it more accessible not only nationally but globally. Improvement focuses on specific goals to reach different objectives, such as enhancing competent parenting and strategies to enhance client engagement and retention so that more ideas stay with them when the program is over. And International Program Implementation focuses on expanding the NFP to different countries after 4 phases of assessment. Phase 1 assesses the needs of the global community, and Phase 2 assesses the acceptability of the program and adaptations that would be needed for each specific community. And Phase 3 is conducting randomized control trials to evaluate expansion of the program. And Phase 4 determines the significance of public health outcomes and if implementation of the NFP is the best fit for their community. David Olds is a pediatric professor at the University of Colorado in Denver, and he developed the NFP after 30 years of randomized control trials to enhance care between mothers and their infants. It took him 30 years to introduce it to the public because he wanted to make sure that the findings were reproducible for other people to have the best thing. The NFP program works by having weekly visits to the mother for the first month after they are enrolled, and then it's bi-weekly visits after that. And then after the infant is born, they have weekly visits for 6 weeks, and then the visits turn into 2 times per week. And that continues until the child is 2, and then the program is over. It was originally developed in El Rima and then was replicated in multiple cities across the United States, and now they plan to expand globally. Statewide initiatives are tailored to the needs of each community and then individual families. They focus on first-time mothers with a low socioeconomic status, and they want to break the cycle of poverty and expand quality of life by helping to give competent parenting skills and increase intervals between births and improve the financial status. Randomized control trials are used to determine the efficacy of the program and assess changes that need to be made for improvement. And each nurse during the program gets a maximum of 25 families, and they have to visit them at any given period. While there's a framework developed for the NFP specifically, nurses have some leniency in determining what will work best for each individual family. When nurses arrive at homes, they not only are introducing skills for competent infant care, they are observing the families and looking for things such as intimate partner violence, mental health, and determining risk and strengths of families. Nurses then have the ability to compare their findings with previous results and adjust the framework to better fit the family's needs. Successes that have been found from the Nurse-Family Partnership include a 48% decrease in child neglect in families who were involved in the program, and a randomized control trial was conducted to assess the effectiveness of the NFP on females born to high-risk mothers and their chances of entering the criminal justice system. When they were compared to a control group who did not have at-home nurses visiting them, there was a 30% chance that girls would be into the criminal justice system if they did not receive at-home nurse care. And a follow-up randomized control trial was conducted 7 years after the program, and for some females, the research found reductions in subsequent birth, increase in family stability, and reduction in child mortality by preventable causes. A control group, children who received no at-home visits, were 4.46 times more likely to die from preventable causes than families who were involved in the NFP.
All right, so the concept, it takes a village to raise a child, fits in with the Nurse-Family Partnership because its large focus is on the community. The Nurse-Family Partnership is found in most states and is customized to the specific families and communities it's working with. This encompasses the idea that parents alone cannot raise a child without full community support, which is one of the aims of It Takes a Village to Raise a Child. Thank you.